Hello, my name is Debbie Atkinson, Team Leader for the Specialist Palliative Care Team. This week is Dying Matters Week. The focus of Dying Matters this year is based on the importance of being in a good place to die. There is no right or wrong place to die. It will be different for everyone. But it is important for families to think about it, to talk about it and to plan for it. We want people of all ages to be in a good place when they die, physically, emotionally and with the right care in place. The last year has seen an increased amount of people dying in our hospital due to the COVID pandemic, and we acknowledge that this has been heart-wrenching for families that were unable to be with their loved ones at this important time. The Specialist Palliative Care Team would like to share with you ways in which Mid Yorks have supported patients and families during this difficult time, ensuring that they are as prepared as they can be.
My name is Justin and I'm the end-of-life care facilitator for the Trust. An aspect of being in a good place to die physically is advanced care planning, and this is the term used to describe the conversation between people, their families and carers and those looking after them about their future wishes and priorities of care. Advanced care planning is a key means of improving care for people nearing the end of life and enabling better planning and provision of care to help them live well and to die well in a place and in the manner of their choosing. The main goal is to clarify people's wishes, needs and preferences and to deliver care to meet those needs. We always ask our patients their preferred place of care and death, and where appropriate have the fast track and rapid discharge pathway in place to get them there. The Specialist Palliative Care Team, Mid Yorkshire Intermediate Care Team, our community nursing colleagues, Marie Curie and other various agencies all support patients to die well at home. Some patients choose to die in hospital or can't be transferred anywhere due to a rapid deterioration. And we as a team support these patients, their loved ones and staff looking after them. Some of the services and comforts we have in hospital include open visiting, although we acknowledge that this wasn't the case last year, which was very upsetting and challenging for families. Concessionary parking, refreshments, relatives overnight stay rooms, and on wards we have end-of-life care drawers. In end-of-life care, it's the small things that make a big difference, and these drawers contain comfort packs, jewellery pouches, blankets and connection hearts, which have been made by volunteers and have been used so much this last year. As part of our assessment in hospital, we always ask if there's anything we can do to make this time feel easier. What's important to you? That may be organising a visit from a beloved pet, and we encourage and see many people's pets, usually dogs, visit them in hospital. We may ask a patient about their favourite flavours, encourage mouth care, which is important at end of life, be given with a favourite tipple. Recently, we've seen patients and families enjoy one last gin and tonic or a Prosecco together, and talking about those favourite drinks and favourite flavours often evokes happy memories. We may also talk about music, and we often speak about favourite songs and again encourage music to be played. Key elements of end-of-life care are love, comfort, dignity, kindness and respect. We are very mindful that you only get one chance to get end-of-life care right, and that a good death lives on in the memories of those left behind, and this can help with bereavement.
Hi, my name's Angie. I'm a CNS at the Specialist Palliative Care Team at Mid Yorks. At Mid Yorks, we are breaking the taboo subject of talking about death and dying. We support with those conversations and help to alleviate those fears and anxieties. Over the last year, during the COVID pandemic, it's faced us with many challenges, and we managed to open a ward specifically for end-of-life care patients dying of COVID and supporting those patients and families going through crisis.
Hi, my name's Sharon Green. I'm one of the Macmillan Clinical Nurse Specialists at Mid Yorkshire Hospital. Dying Matters Week is focusing on being in the right place at the end of life, and this also includes being prepared financially. Patients with an end-of-life diagnosis will naturally have concerns regarding their financial affairs. It is likely you will be able to get benefits in the last months of life to help with your care and also to get free prescriptions. We can also help arrange benefits such as PIP and attendance allowance to help with any additional costs. Thinking about your funeral costs is also important, and if necessary, funding can be obtained to help with this. Organising bank accounts and pension schemes is also important. You could consider contacting a solicitor to arrange a power of attorney for your financial affairs. This is a legal document that allows you to appoint one or more people to help you make decisions or to make decisions on your behalf. This includes managing your bank account, paying bills, collecting benefits and pensions, and selling your home. The Macmillan Information Centre at Pinderfield Hospital is an amazing source of support and advice, and our team will ensure patients are referred to the centre and complete any necessary forms to ensure appropriate benefits are paid.
Hi, I'm Catherine and I'm one of the Macmillan Specialist Palliative Care nurses at Mid Yorkshire. We address patients' spiritual needs by asking what is important to them. By discussing what their core values are, we can help provide comfort at the end of life. We help to facilitate any requests made by patients, whether this be religious or personal to them. We have a chaplaincy service who have a group of multi-faith leaders who work across the trust, helping to meet patients' religious and spiritual needs.
Hello, my name's Deborah Ackroyd and I'm one of the Macmillan Specialist Palliative Care nurses at Mid Yorkshire. Part of advanced care planning is from a digital perspective. Part of being in the right place when thinking and planning about what your care preferences would be if you were approaching the end of life has become increasingly more important as the digital age has become part of everyone's everyday life. A large majority of people now use internet banking and have social media accounts that you may not have ever even considered what may happen to these after your death. Part of planning to be in a good place at the end of your life involves considering if a digital executor named in your will to help access and/or close down your existing accounts and manage the information and photographs attached to this may be something that you would want. If you have considered entrusting somebody with power of attorney for both health and finance, then this can help prepare for managing and looking after the important factors of your digital footprint, such as your internet banking and social media accounts. Over the last year, the COVID-19 pandemic has resulted in the loss of many people's lives of all ages, with little time for them to plan or prepare as they approach the end of their life. This left many people without the opportunity to make their wishes known about what they would want to happen with their online accounts. Keeping passwords safe is a necessity to prevent abuse or harm. However, if you had already got a plan for a trustee or executor to handle this for you, in the event that you lost capacity to do this safely, it's extremely well worth thinking about. The digital age definitely brings many challenges that over the last century were not as needed to be at the forefront of our lives as they do today, when people make their wishes known about their future care and preferences for this digital care. A positive component of the digital age is that it has improved our ability to communicate with others, and this is why during Dying Matters Week it is an opportunity for us to start conversations with our loved ones about how we would want our data and information sharing. The Mid Yorkshire Specialist Palliative Care team has worked in caring for palliative care patients over the pandemic, both face-to-face and by supporting ward teams and community nursing teams to care for patients that were dying from COVID and for those dying from other life-limiting illnesses. For those patients that were in care homes and inpatient wards during the pandemic, they were often without their family members to physically support and be with them. For these patients, digital technology became a vital role in improving communication via video calls and regular telephone calls from ward and care home staff to help relatives see their loved ones and be reassured that all of the staff at Mid Yorkshire were striving to provide the support and be physically present when these valued patients died. Thinking about what you would want and would not want as a means of communication and letting your loved ones know who you would want digital communication with in this manner would also help others know what your wishes are and follow these at the end of your life. Thank you.
During Dying Matters Awareness Week, we're opening up the conversation around death, dying and bereavement, and we're asking you to think about what it means to be in a good place to die. We make plans throughout our lives, but one of the most important, crucial plans that is often forgotten or avoided is our end-of-life plan.